A 35-year-old female with a history of epilepsy presents to her neurologist for a routine follow-up visit. She is currently on long-term treatment with Phenytoin to control her seizures. During the visit, the patient informs the neurologist that she is planning to start taking oral contraceptives for birth control. Now the question is, what should the neurologist advise the patient regarding potential drug interactions? A. Oral contraceptives may decrease the effectiveness of Phenytoin. B. No interaction. C. Phenytoin increase the toxicity of oral contraceptives. D. Oral contraceptives increase Phenytoin toxicity. The right option is A. Oral contraceptives may decrease the effectiveness of Phenytoin. Oral contraceptives may decrease the effectiveness of Phenytoin due to a drug interaction mechanism. Phenytoin is primarily metabolized by cytochrome P450 enzymes, specifically cytochrome 2C9 and cytochrome 2C19. When oral contraceptives induce these enzymes, the metabolism of Phenytoin is enhanced, leading to decreased plasma concentrations of the drug. This reduction in Phenytoin levels can compromise its effectiveness in controlling seizures, as the drug may fall below the therapeutic range. Phenytoin, too, decreases the effectiveness of oral contraceptives. Therefore, it is important to inform patients using Phenytoin and oral contraceptives about the potential decrease in effectiveness. Alternative methods of contraception or adjustments in Phenytoin dosage may be recommended to ensure both seizure control and contraceptive protection. Additionally, close monitoring of Phenytoin levels, seizure frequency, and the need for additional contraceptive measures is advised when using these medications together. A 65-year-old female with history of hypertension and type 2 diabetes presents to her physician with complaints of joint pain and stiffness. She has been taking an angiotensin-converting enzyme inhibitor for hypertension and metformin for diabetes for several years. The physician suspects osteoarthritis, and for pain and stiffness he needs to prescribe a medicine. Now the question is, which of the following drug class has a potential drug interaction? A. Beta blockers. B. Selective serotonin reuptake inhibitors. C. Non-steroidal anti-inflammatory drugs. D. Calcium channel blockers. The right option is C, that is, non-steroidal anti-inflammatory drugs. Explanation. NSAIDs are commonly used for pain relief in the osteoarthritis. But NSAIDs can reduce the effectiveness of ACE inhibitors, that may lead to reduced effectiveness in lowering blood pressure. NSAIDs inhibit production of prostaglandins. Prostaglandins helps in maintaining the renal blood flow and the sodium and fluid balance in body. That's why NSAIDs can decrease the vasodilatory and blood pressure lowering effects of ACE inhibitors. As a result, using NSAIDs in patients taking ACE inhibitors can increase the risk of elevated blood pressure and reduce the effectiveness of antihypertensive therapy. Therefore, alternative pain management options, such as acetaminophen or topical analgesics, should be considered in this patient to minimize potential drug interactions and adverse effects. It is important to consult with the patient's healthcare provider for personalized recommendations based on their specific medical history and current medications. SSRIs are commonly used for the treatment of depression and other psychiatric conditions. While they do not have direct drug interactions with ACE inhibitors or metformin, combining calcium channel blockers or beta blockers with ACE inhibitors is commonly done in the management of hypertension and certain cardiac conditions. While these combinations can have additive hypertensive effects, they are often used under the supervision of healthcare professionals who carefully monitor blood pressure and make necessary dose adjustments. Close monitoring is essential to prevent excessively low blood pressure. Subscribe to our channel for more informative videos.